Medicare is really great insurance and quite expensive. However, there are a handful of items that are not going to be covered by Medicare. In this list of very important services not covered by Medicare would be routine dental, eyewear, and hearing aids. So in this video, I'm going to show you what's covered and what's not covered around these items and how you can get additional insurance just in case you need it and want it. Now, I want to begin by reviewing our different options available to us as we go on Medicare, because how you decide to use your Medicare will also determine the options you're going to have for your dental and your vision and your hearing aids. All right, so let's look at these just real quickly. Number one, this is an option that people have, and that is to go on Medicare and just simply have A and B only, meaning they have no additional insurance beyond A and B. Just so you know, my opinion is, though this is the first one mentioned, it's the worst option that I think anyone can select because of the great liability that comes with having A and B only. All right, but I want to be clear, this is one option. The second option would be someone who decides they want to be in the original Medicare system. We call that traditional Medicare because of the benefits of that, meaning there's no networks, no pre-authorizations, and the permanency of this type of coverage. But instead of being responsible for all the financial gaps, if I have A and B only, what I do is I purchase a supplemental plan, and we actually add that to our coverage, and this would be the supplemental plans that are made available by private health insurance companies to fill in the gaps that Medicare does not cover, because Medicare doesn't cover anything 100%. There's always a financial liability beyond preventive services that you'd have to pay, and so we get a supplemental plan to fill in those financial gaps. Most people today are either getting the Plan G or the Plan N. So if we go this direction, again, that's going to affect our options for our dental, our vision, and hearing aids. And then the last option would be what we call Advantage plans. And so this is when someone enrolls in A and B, but instead of having A and B administer and oversee their coverage, now what's happened, it's being replaced by a private health insurance company that puts together what we call a coordinated care plan. And those are called Advantage plans. Okay, so here's the way this works. About 10% of people do this, about 40% of people do this, and 50% are going to do that. All right, and so as we make this decision to use our Medicare benefits, it also is going to affect our options for these other services. Let's look at those. All right, so we're going to begin actually by talking about our dental options, then we'll look at vision and hearing aids next. So as it comes to our dental options, again, once we decide how we're going to use our Medicare, this first column is going to represent the coverage that we're going to have without a supplemental plan or with the supplemental plan. That would be the same here. All right, and so then when we get a supplemental plan, then we also have the option to buy what we call an ancillary plan. It's additional insurance, it's auxiliary, it's supportive of our plans, and so it's going to come alongside and actually be a dental plan that is supplemental in addition to the limited benefits that Medicare is going to cover. And then, of course, we'll talk about how the Advantage plans are going to cover dental. All right, so let's look at this first column. So again, this is original Medicare. Whether I have a supplemental plan or not, this is that original Medicare A and B system. So here's what I want you to realize. When it comes to dental, we have very limited coverage. We have some, but it is limited. So I actually want to read this verbatim because I think it's important for you to note how original Medicare is going to take care of dental. And here's this article. It says, original Medicare Parts A and B generally does not cover routine dental care such as cleanings, fillings, or extractions, but may cover dental services that are medically necessary and related to other covered procedures like those needed before or during a hospital stay or for certain medical conditions. And that's why I'm describing this as very limited. Okay, the kinds of things that you and I would normally think of, which are going to be extractions, teeth cleanings, fillings, dentures, those kinds of things are not going to be covered by original Medicare. Again, it has to be in conjunction with some other medically necessary service that someone is getting. So let me kind of explain that. The article goes on to say Medicare may cover certain dental services you get when you're admitted as a hospital inpatient for your dental procedures. Again, pretty serious. Either because of your underlying medical condition or the severity of the procedure. Again, we're talking about inpatient hospital stay before this dental would be covered. Goes on to say this, specific inpatient or outpatient dental services related to certain covered medical treatments. In these cases, you must get the dental service because it's linked to the success of the medical treatment you need. So they're going to tie these together. Again, something medically necessary. Your dental health is involved with that. They're going to check that out. And then they give an example, actually a couple of these. An example would be an oral exam and dental treatment before you get a heart valve replacement or a bone marrow, organ, or kidney transplant. It could also include a procedure like a tooth extraction to treat a mouth infection before you get cancer treatment services like chemotherapy. Again, quite serious. Last one, treatment for a complication you experience while getting head and neck cancer treatment services. So again, something's going on in regards to cancer. Maybe someone had maybe jaw cancer or some type of oral cancer, and there had to be some surgery involved with that, and that affected your teeth. So again, they're going to cover the services to make your teeth appropriate after this particular surgery. So again, all I'm trying to teach you, again, very limited with original Medicare A and B. So if someone decides to have A and B only, or they decide to get a supplemental plan, what they can do now, they can buy ancillary insurance. This would be in addition to or supportive of. So again, this is going to give us that additional insurance that we need to get some of these other services covered that Medicare is not going to cover. Okay, we call them ancillary plans, standalone plans. So I'm going to give you the details of these because about half of all people today that decide to stay in original Medicare are actually getting some additional insurance. So let me show you how these programs work. Number one, what you'll notice is that there will be a network of providers that you will be able to go to. And this is real important. People ask me all the time, well, how do I decide upon my dental plan? Well, the first thing we do is find out what your dentist likes and takes. Now, if you don't have a dentist, then certainly that's not the issue. You can find a plan first and then find a dentist that takes the plan. But if you have a dentist that you like and you want to stick with that dentist, it's always wise to find out, are they going to be in the network? Okay, so what we have are in plans are going to be either HMOs or PPOs. Now, most ancillary standalone dental plans are going to be of a PPO network, which means you can go to a dentist even if they're not in the network. You can still go to that dentist. Okay, so that's the whole issue with networks. So you got to be aware of that. Number two, premiums. There's always going to be an additional cost for this. It's not going to be a part of your supplemental plan. You're going to have to actually pay a premium. And again, this is going to vary based upon coverage, but right now these are going to be anywhere on average from about $30 a month to $80 a month. So you got to actually pay for these plans. There's a premium add-on for that, again, depending upon the type of plan and the coverage. Number three, you have to pay attention to what is your annual benefit, meaning how much money is the insurance company going to spend on you for these services that they're going to cover. And again, this is going to vary. Some plans are going to be in the neighborhood of $1,500, and some actually as high as $5,000 a year they'll spend on you. And again, usually when we have a higher premium, we're talking about a higher annual maximum benefit. And this is really critical because this is the company saying, okay, we'll cover you up to this particular amount. And then number four would be the coverage. What are they going to cover? And so what happens here is this. In almost all dental plans, what we have first is we have preventive services. This is going to be your this is going to be your cleanings and your exams and your x-rays. Most companies are going to give you about two cleanings a year and a set of x-rays as well. And so that would be the preventive benefit. And what we find is this is normally covered at 100%. It rarely has a deductible when it comes to preventive. The second type of service covered is going to be what we refer to as basic services. Basic. Now, basic services are going to be your lower cost items, extractions and fillings and those kinds of things, all right? And these are normally covered on about an 80-20 basis, sometimes 90-10, meaning that the insurance company pays 80% of that cost of service and you pay 20%. All right, and so we have that. And then we have what we refer to as major services. And a major service is going to be a root canal or a crown or some very extensive periodontal type work. And it could be dentures. But the point is these are things a little bit more on the higher level of cost, and so that's major. And these are normally going to be covered on a 50-50 basis. The insurance company pays 50% for that service, and you're out of pocket 50% as well. So we're paying attention to what's the coverage on my plan as it relates to preventive, basic, and major services. Now, the next thing we want to talk about are waiting periods. You'll note that some companies are going to say, once you start a plan, we're going to put you through a waiting period, meaning we'll cover your cleanings right out of the gate day one, but basic services may not be covered for 6 months. Major services may not be covered for 12 months, and so you have waiting periods. Now, some companies will advertise that they don't have a waiting period, but what they will do is they'll say this, during the first 6 months of the policy, we'll only cover 20% of that instead of 80%, or for your major services, we'll cover 10% of that instead of 50%. So they may not have a waiting period, but they may have a lower coverage amount for a certain period of time. So again, you have to pay attention to the detail on when they're going to cover you and for how much. All right, so that's a waiting period, meaning you're not going to be able to, most plans pay 1 month's worth of premium and then go get a $1,500 root canal. It's probably not going to happen because there will be some type of a waiting period before that will actually be covered. And then lastly, I want to talk about best time to buy. When is the best time to buy? Well, for those of you that have been working or your spouse is working and you've been covered by a dental plan at work, a group plan, the best time to buy is within 30 to 60 days of losing that plan. And the reason for that is because most insurance companies, as long as we prove to them that you actually had insurance that you just lost in the last 30 to 60 days, they'll enroll you in a plan. And what they'll do then is they'll oftentimes waive the waiting period. So you have immediate coverage, and the reason because they know if you had a plan, you were probably staying on top of your dental work. You're probably not going to come on the plan and have some real expensive cost to them because you already had dental insurance. So they actually reward you because you had previous coverage by waiving the waiting periods. And all I'm trying to teach you are these are the different aspects of a dental plan that you have to be paying attention to whenever you decide to make this additional purchase, this ancillary insurance. And again, there's lots of them available. You work with us, we'll look at, of course, different companies and the different networks so to make sure that you are able to find a plan that your dentist likes and your dentist takes. All right, so now let's talk about those of you that decide to get an Advantage plan. Now, when an Advantage plan is made available, what you have is a private health insurance company now that is overseeing and administering and really directing your Medicare care. You're actually still on Medicare A and B, but you're not in that system any longer. You've come out of that, and now it's a private health insurance company that is actually directing that care. And so what all of them are going to do is they're actually going to give you some additional perks. And this could be gym membership, it could be a variety of different things, but it almost always is going to include some type of dental type of situation. We call these dental allowances. Some people call them a plan. I don't, because these are really plans. This is a dental allowance. So what I'm going to do is I'm just going to show you three different Advantage plans. I'm not going to actually name them other than just to show you how they would cover you if you're on that particular plan. And these are going to be really consistent with what's going to be in most markets around the company. So let's look at the different allowances that are available on Advantage plans. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. And just so you know, this information I'm going to share with you are just simply verbatim, really word for word, things that I have found and really extracted from the Advantage plan's summary of benefits. That's where you get all the details of the coverage in the summary of benefits. So let me show you some of these. So this is one, again, word for word, right out of the book. And this particular company, again, this was an Advantage plan. This was a PPO type of Advantage plan. And they are offering for dental, notice, a $2,000 benefit amount. And again, they call it an allowance. And this is notice it's every year. So it would reset every year, every January. And this is for whether you use an in-network dentist or an out-of-network dentist, you actually get to use this full $2,000 benefit. And also notice, it covers preventive, again, your cleanings, your x-rays, your cleanings, and the exams that go along with that, as well as comprehensive. And this would be your basic services I talked about, and your major services. All those things are going to be including comprehensive. All right? And so we have this $2,000 benefit. Now, also notice this, though. If we use an in-network provider, our pricing is going to be much less. There will be several things that are actually going to be, when it comes to preventive, all zero copays. On the comprehensive, same thing. Lots of zeros here. Why is that? Because we get to spend all the way up to that $2,000 benefit. So we can find a dentist that actually happens to be within this network of this Advantage plan. It would certainly be in your best interest. And if you find a dentist that's not a network, then what happens? It's an out-of-network dentist. They'll still spend the $2,000 on you. However, when those bills are submitted from an out-of-network dentist, well, look what happens. Now you're going to have to pay 50%, and the plan will pay 50%. So in other words, you're going to have to spend $4,000 to be able to get that $2,000 benefit, because they split this with you again 50-50. And again, that's why I always emphasize, let's find out what network your dentist is in. Do they like this plan and take this plan? Because it certainly makes getting those services much, much easier for you. All right, so that was one Advantage Plans allowance. Let's look at another one here. Now this particular company actually offers just $1,000. And again, it's combined maximum benefit, meaning whether that's going to be for comprehensive services or just preventive services, doesn't matter. And that's what they're laying out here. And notice what's going to happen here: dental cleanings, oral exams, dental x-rays, restorative services, endodontics, periodontics. All these things, again, are going to be, as long as we're in network, are going to be a zero copay. But instead of like that other company offered $2,000, that's the most that we're going to get out of that particular program. That's it. You'll notice that if we go out of network, look at this one, there'll be a 30 to 40% coinsurance on restorative services. Dental, endodontics, all the others were still zeros, but you'll see every now and then, instead of them paying for that in full up to the $1,000, now you're gonna have to be out of pocket maybe 30 to 40%. Okay, so let's just quickly look at just one more. Now this particular company actually does things even a little bit different. Notice what they have here. They have an optional dental rider. And so this company actually did give some coverage here, but notice it was only for preventive. So that preventive was 100% coverage. But again, this is only then a couple cleanings a year and your x-rays and your exam, that's it. But beyond that, again, that's zero copay, but beyond that, what happens is if I want additional coverage for comprehensive, the basic service, the major services, now I actually have to buy this rider. All right, and you'll see that this rider is going to cost me $54 a month. So again, not a real rich benefit. The other one was $2,000 included. The other one $1,000 included. But here, what happens? Only preventive services. So if someone enrolled in this Advantage plan and they do want some additional services, and what's going to happen? They're actually going to have to pay for that. And so for that $54 a month, notice what's going to happen. They call this a Platinum Dental Rider, and they're going to get $1,500 worth of benefit. And again, all the services that someone was going to want and need is going to be covered by that. And again, notice this down here, there's a 50% coinsurance on dentures and bridges. So those would not be covered at 100%. Now we could use our full $1,500 for either one of those, but I'm going to have to spend $3,000 in order to get that $1,500 benefit. All right, so again, just another option that this particular company offered. So all I'm trying to teach you is that when someone enrolls in an Advantage plan, there will be some type of dental allowance. We just have to find out how much and how we're going to be able to use that benefit. All right, so that was the dental benefit. Now let's talk about the actual vision benefit. And again, the same chart I showed before. This particular column is just what original Medicare is going to offer you, including that supplemental plan. And then we have the option to buy ancillary vision plans as well. And I'll show the details of that. And then also we'll have Advantage plans that are going to provide some additional perks for vision. And so let's start by just talking about what original Medicare is going to do. Now, I want you to notice here, remember how we talked about dental? The word we used there was limited. It was very limited, and we saw why. But when it comes to vision with original Medicare A and B, with or without supplemental plan, notice what we're using here. It is very, very extensive coverage. I mean, wonderful coverage. And actually, there's only two exclusions, two things that are not going to be covered by the original Medicare. So we have great coverage with Medicare by itself. Okay, so let me just read this quick article to you verbatim. Here's what it says. Original Medicare will cover medically necessary eye care for certain conditions such as cataracts, glaucoma, diabetic retinopathy, and age-related macular degeneration. Okay, in other words, it covers that. So I'm saying very extensive. All those items covered by A and B. They'll also cover diagnosis and treatment of eye conditions. They'll pay for and cover cataract surgery. Also, limited coverage for glasses after cataract surgery. They'll also pay for eye exams if you have specific risk factors for eye diseases such as diabetes or glaucoma. So again, that's what we're saying. Very extensive, medically necessary type of vision coverage with the two exclusions. What are those exclusions? Well, there's only two. And the first one would be any kind of eyewear unless it's after cataract surgery. All right, so if just your normal, you want to go in and get new glasses, new prescription, that's not going to be covered by Medicare unless it's after cataract surgery. So eyewear is one of the exclusion, and the other one would be exams, eye exams for eyewear. If I need an eye exam because I'm a diabetic and I get 2 of those covered a year, again, great coverage by Medicare. Or if I'm having, seeing, the spider floaties within my eyes, there's a vision problem going on, that eye exam is going to be covered by Medicare. Just the eye exams that are for eyewear are not going to be covered by Medicare. So again, A and B, with or without supplemental plan, what do we have? We have very, very good coverage. Now, when it comes to people who say, well, I'd like to have some eyewear coverage and eye exam, you actually can buy, again, an ancillary product, just like we do on our dental. We can buy an insurance plan. And so let me just very quickly teach you the details of these supplemental vision type plans. So number one, again, there's networks. Now, most plans right now are going to have either what we refer to as an iMed network or VSP. These are your 2 larger networks. I'm not saying all plans have this, but the majority of them are going to have one of these 2 networks. Secondly, there's going to be a premium. Now, these premiums are going to certainly vary from plan to plan for sure, but we see these going anywhere from about $12 to about $18 on a monthly basis. So certainly not real expensive, but there would be an additional premium for sure. Number 3, the annual benefit. Now, most of these, when it comes to this annual benefit, what they're going to do is they're going to give you some discounts on your eyewear for sure. And then not only with the discounts, they also are going to cover you anywhere in the neighborhood of about $300 on an annual benefit for contacts and eyewear and those kinds of things. And then you certainly would get discounts on lenses as well. All right, so that's the way annual benefit works. Now, the coverage itself, again, this is going to be for what? The things that Medicare didn't cover. So this is coverage about eyewear and exams for eyewear. They're normally going to give you one eye exam at no cost to you, beyond, of course, the medically necessary ones by Medicare. All right, so that's going to be the coverage here. And then when it comes to best time to buy, the majority of people find the best time to buy is when they actually enroll into a dental plan. Most companies offer additional coverage for vision if you want it. Now, you don't have to have a dental plan to do that, but again, the best time to buy would be coming off of a group plan. So if you had vision part of your group, within that 30 to 60 day range would be the best time to actually add that dental and add that vision as well. All right, and so that's the ancillary plans. Now let's talk about advantage plans. In other words, again, it's a perk, it's something else they're going to add to it like they did dental, but again, it's going to be an allowance, and this allowance is going to vary plan to plan, so let's look at some quick examples. All right, so this particular advantage plan, what they do is offer this vision allowance, this benefit. You can see here a routine eye exam, as long as you stay within the network, it's going to be a zero copay. Almost always that's limited to one of those routine eye exams once a year. And then contact lenses, again, zero copay, right? Now, but watch though, same thing is going to happen when it comes to eyewear. This plan pays up to, look at this, $300 every 2 years, all right? So $150 a year they'll spend on you for one pair of frames or contact lenses, all right? We have zero copay, but again, there's going to be a limit as to how much this particular company will actually cover. Now, what also to note on this, notice this, it says home delivered eyewear available nationwide only through, now we had to block this off because this is an educational video. I'm not supposed to actually show you the names of these companies. It's off limits for this type of video, but I want to make sure you know that they're saying that we need to use this services through a certain network, which may or may not be a problem. They may have exactly what you want, but again, it may have a network limitation. All right, so here's another company's allowance within their Medicare Advantage plan. Again, you're going to see the same thing. Routine eye exams, contact lenses, eyeglasses, all these are going to show up at a zero copay. But look what they say. They're saying here, we just have $100 maximum benefit coverage per year. So the other one had $300 for every 2 years. This one is just simply $100 a year. But also notice we're going to have to use a certain provider for the contact lenses and this other benefit. We're going to have to go to a network provider. And again, that may not be a big issue. Could be if your provider's not within the network. So again, we still have just that $100 allowance. And then just one more real quickly. And so what this company is offering, notice here, we have a $150 benefit, and again, still called an allowance, and this is reimbursement every year. So sometimes you may go to a provider and they don't take the plan, but it's all right. You actually pay for it out of pocket, and you fill out a form and a reimbursement form. You actually get your $150 paid back that way. All right. And again, you're going to notice they have in-network and out-of-network situations. Clearly, if I go out of the network, then it's going to take me a little bit longer, a little bit more money out of my own pocket to be able to benefit from the $150. Otherwise, what's happening, we have eye exams for sure, and they're going to cover that as well as give us that $150 for contacts or for glasses and lenses. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, so that takes care of the dental aspect and the vision aspect. Now let's look at hearing options. Again, back to the same chart. If I have Medicare A and B only, with or without supplemental plan, ancillary plans for hearing, as well as how the Advantage plans are going to take care of hearing as well. All right, so let's talk about original Medicare A and B. Again, we use the word limited. Certainly we have some coverage, but not everything. And so I'm just going to kind of read this article to you as well. I think this describes it very well because there are some things that are covered, those things that would be medically necessary. So just verbatim again, you can see an audiologist once every 12 months without an order from your healthcare provider, meaning just call up an audiologist, make an appointment, but specifically for non-acute hearing conditions. And this would be conditions where there's hearing loss over an extended period of time. This article says diagnostic services related to hearing loss that's treated with surgically implanted hearing devices. So if I go through surgery and it's implanted, then I certainly can have those kinds of follow-up visits that will be covered by Medicare. Okay. Also, if a person's ear is blocked, this means by wax, and their doctor believes it's medically necessary to remove the impaction, Medicare B will also cover that particular service as well. All right. And so if you have a visit to an ear, nose, and throat doctor and it's considered medically necessary, then again, your Medicare Part B is going to cover that as well. Part B will cover certain diagnostic, hearing, and balance exams when it's ordered by a doctor or any healthcare provider to determine if medical treatment is needed. All right. But what it's not going to cover, though, will be hearing aids or exams for hearing aids. So that's what we're saying. We certainly have coverage, but it's going to be limited, all right, to medically necessary items. And so as in regards to hearing aids, exams for hearing aids, not going to be covered by A and B. And so what happens, there are some people actually will get plans to cover them, and these would be ancillary. These would be typically purchased at the same time of dental vision. We actually give these the letters DVH, dental vision hearing, and what we'll oftentimes see is anywhere from about a $200 to $300 benefit for hearing aids. Okay, not a whole lot, but again, there's some additional, and a lot of the dental and vision plans actually just include that as part of their coverage, but again, still limited. Now let's talk about how Advantage plans are going to cover hearing aids. Again, they have perks, gym membership, dental vision, and now for the hearing aids, let's look and see how they will be covered here. And again, it's going to be an allowance, so let's look at the different allowances by the different Advantage companies. Okay, so this is one Advantage company right out of a summary of benefits. And again, we're going to see here what happens if we get from an in-network provider and what happens when we get an out-of-network provider. And so here it says $30 for Medicare-covered hearing exams. Those are the ones where maybe there's an impaction or there's some type of hearing loss over an extended period of time. Those, again, covered by Medicare. You would have a copay of $30 for that particular hearing exam. But if it's not covered by Medicare, what's going to happen is it actually would be a zero copay. Why? Because now we need to find out are hearing aids, are they working appropriately, properly? And so again, you can get one of these on every year. They'll cover one of those. All right, as long as you stay, of course, within the network. And then notice also a zero copay for fitting and evaluation for the hearing aids. Again, that wouldn't cover by Medicare, but would be by your Advantage plan. But again, you have a maximum of one of these evaluations on an annual basis. So if I go within my network, what happens? I have a zero copay, but that benefit amount is going to be $1,500. And again, that's going to be allowance per year for hearing aids. All right. So as you can see, we can get a maximum of 2 hearing aids every single year, 1 per ear. And so, but again, it's going to be that $1,500. So if you were to go above that, then of course you'd be out of pocket on that. And so again, that would be your allowance. And if you go out of network, again, they'll still spend the $1,500, but before that happens, you're going to have to pay 45% out of your own pocket. They will cover up to 55% of that, again, with that allowance. So that's just one particular company, how they've chosen to cover hearing aids. Now, this next Advantage company, here's the way they're going to do that. You're going to see, again, routine hearing exams, zero copay per visit. Again, typically this is going to be one a year. The hearing aid fitting evaluation, again, zero copay. But notice what they're going to do. If we have a prescription for a hearing aid, what they're going to do is this. You have to get it from an in-network provider, and you're going to have a copay from $699 to $999, which is basically a $700 to $1,000 copay that you'd be responsible for. All right. And again, they're going to lay this out here a little bit differently. Here we get a routine exam, so $699. Notice what they're saying. If you use an advanced level hearing aid, if I use a premium level hearing aid, then my copay is going to be $999. And again, we can get one hearing aid per ear per year. All right, let's just look at one more. Now this company, what they're going to do, you're going to notice, again, same thing, diagnostic exam is going to be zero copay. Now notice if I go out of the network, it's going to be a $70 copay. I always charge you more when you're going out of network. And so notice here, that's going to be one per year. But look how they're going to cover the hearing aids. And so what they have is two different options here. If you find an over-the-counter hearing aid that is the best for you, then you're going to have a copay of somewhere between $99 to $829. But if I have a prescription hearing aid, what's going to happen, my copay is going to be a little bit higher, anywhere from $199 to $1,249. So they don't really just give you an allowance. They're saying based upon the type of hearing aid you need, they'll specify an exact copay. And again, same thing, you can get one hearing aid per ear per year. All right, and so you can kind of see it's going to vary. They're going to cover hearing aids. It could be network, could be out of network, could be allowance, could be a copay. So it will vary plan to plan. So if you need and want additional coverage for dental, for vision, or for hearing aids, now we know what our options are, and you can decide what will be best for you.